Namaskar, my dear students. Today in the dental materials section, we will be discussing about the bonding agents. First, we will discuss about the concept of bonding with the enamel, then with the dentin, and then we will proceed with the different generations of the dentin bonding agents. This is an important topic in regard to the theory questions, then the grand viva, and also it is also kept as a spotter in the practical final exam. Okay, then multiple choice questions are also framed from this topic. So let's begin. Now, first of all, what is bonding or what is adhesion? It refers to the attachment or the binding of one substance to the another. Now, this can occur by different mechanisms. First is the physical, which is based on the dipole-dipole interactions. This is comparatively weaker. Second is the mechanical, based on the surface irregularities. It can be micromechanical or macromechanical depending on the size of the irregularities. Third is the chemical, which is based on the covalent or the ionic bonds formed between the two substances. Now the adhesion can also be the combination of two or more. The second question is why we need this bonding or the adhesion. We need a good bonding between the restorative material and the tooth so that there is absence of any marginal gap. This will minimize their micro leakage, okay, which is occurring at the margins, and this will further prevent any kind of secondary caries. Next comes the requirements for the good adhesion. How we can achieve a good adhesion. First, there should be a clean surface or the substrate. If there is any kind of contamination, it will interfere with the adhesion. Second, the adhesive should be of low viscosity. It should have a low contact angle with the adherent. Then only it will lead to a good wetting, okay, and lead to a good adhesion. Third, there should be intimate adaptation between the adhesive and the adherent. The adhesive should fill all the surface irregularities which is present in the adherent and provide a good surface wetting. Last is the high bond strength between the adhesive and adherent. This can occur by the micromechanical means, the surface irregularities that we are creating, or second by the chemical bonding. Now let us understand the concept of bonding with the enamel and the dentin step by step. First, let us talk about the enamel bonding. Bonacore, he advocated the acid-etch technique for the adhesion of resin to the tooth. This brought the revolution of the adhesion. What is etching? It is the process of increasing the surface reactivity of the enamel by demineralizing the superficial calcium layer and creating the enamel tags. What does the etching do? It forms a microporous layer. It removes the smear layer. It removes about 10 micrometer of enamel. It exposes the enamel rods to create a honeycomb-like appearance, which gives increased surface area, increased retentive area. And the etched enamel, it has high surface energy, which allows the resin to readily wet the surface. So it increases the wettability also. Once the etching is done, the resin, it penetrates into this microporous layer and it can be polymerized to form a mechanical bond to the enamel. Now let us know more about this enamel etching. First, the etchant that we are using. Many acids are used as an etchant like malic acid, citric acid, oxalic acid, but 37% phosphoric acid is the most common etchant which is used in the gel form. Okay, to make the application more precise. Now, if the concentration of phosphoric acid is more than 50%, then what happens? The monocalcium phosphate monohydrate, it gets precipitated. That can be rinsed off, so it will prevent further dissolution. And if the concentration is less than 27%, then the dicalcium phosphate monohydrate, it is precipitated, which cannot be removed easily and it interferes with the adhesion. So the concentration of phosphoric acid should remain between 30% to 50%. Coming to the etching time. Initially this etching time was 60 seconds, but then now it is reduced to 15 to 20 seconds. But we need increased etching time for the teeth with fluorosis. Okay, because they are acid resistant. And second, we also need more etching time for the primary teeth because of their aprismatic enamel structure. Let us discuss the steps of enamel bonding step by step. The first step is etching. As we just discussed, that we will apply the etchant with a syringe form. It contains the gel or the applicator. We will apply the etchant on the tooth surface. It will convert the smooth enamel into the irregular surface. Okay, it increases the surface energy also to increase the bonding, as we have just discussed. After the etching of the enamel surface is done, the surface is thoroughly rinsed with a continuous stream of water for 5 to 10 seconds so that the acid is completely washed off. This is followed by the proper drying, which will produce a frosty white appearance, as we can see in the picture. Now, if the contamination of the etched and the dried enamel has occurred, then we will repeat the procedure. We will re-etch the surface and repeat it, because any contamination with the saliva, moisture or blood, it can prevent proper bonding. Now then, followed by the enamel bonding agents which are applied. They are hydrophobic resins. They are low viscosity monomers which contain bis-GMA, UDMA, TEC-DMA, HEMA. Okay, as the enamel, it can be kept dry. So these hydrophobic resins, they work well when they are confined only to the enamel. They give a good predictable high bond strength of around 20 megapascals. Second is the dentine bonding. Bonding to the dentine is challenging and difficult. It poses many problems. The first is that its composition. It contains only 50% of the hydroxyapatite, 25% of water, and 25% of type 1 collagen, that is the organic material. Second is there is random arrangement of the hydroxyapatite crystals in dentine, which also interferes with the bonding. Third is presence of dentinal fluid, which continuously flows from the pulp. Okay, then sclerosed dentine, which is difficult to penetrate and create a bond. Dentinal tubules, they exert pressure of around 25 to 30 millimeter of mercury. It decreases the stability of bond between the resin and the dentine. The dentinal tubules, they also make the dentine sensitive. Cut dentine is covered with a smear layer. What is a smear layer? It is a residual organic or inorganic material which is formed when the tooth is prepared with a burr or an instrument. Okay, it is around 1 to 10 micrometer thick. How the optimal bonding can be obtained? It can be obtained by removing the smear layer. Removal of the smear layer, it increases the dentine permeability by 90%. Okay, last but very important is close proximity to the pulp. As the dentine is close to the pulp, so different chemicals which are used for bonding and etching, they may irritate the pulp. Now let us understand the dentine bonding agent. What is a dentine bonding agent? It is the thin layer of the resin which is applied between the conditioned dentine, that is the dentine or the smear layer tooth structure, which is hydrophilic in nature, as we can see in the picture, and on the other side there is the resin matrix of the composite, which is hydrophobic filling material. So it has to form an adhesive bridge between the hydrophilic and the hydrophobic end. So this dentine bonding agent also has two ends, hydrophobic, that is M, and the X, which is the hydrophilic end, and the R is the spacer molecule. Okay, the M, which is the hydrophobic end, it will bond with the resin. Okay, and the hydrophilic end, that is the X, it will displace the water, permitting it to penetrate the porosities of the dentine, and then it reacts with the inorganic or the organic components. And R is the connecting link. It is the spacer molecule such as the hydrocarbon chain. Evolution of dentine bonding agents. This evolution has occurred from the no etch technique to the total etch and now the self etch. So based on this, there are 7 generations. Let us discuss them one by one. Let us start with the first generation bonding agents. Okay, so there was development of the surface active co-monomer, which was NPG-GMA, N-phenylglycine glycidyl methacrylate. Okay, so this was the first commercially available bonding agent. Theoretically, it was supposed to chelate with calcium, okay, calcium in the dentin, and form a water resistant chemical bond with the dentin. In this, if we see the M, it is the unsaturated methyl methacrylate group, and the X is the acidic phosphate group to react with the calcium of the dentin. Okay, the smear layer was ignored. There was adhesion to the smear layer itself only, it was not removed. So there was no micromechanical bonding in this. Okay, the bond strength which was produced by the agent with the dentin was very low. It was around 2 to 3 megapascals. Clinically also, this agent did not successfully bond the composite resin to the dentin. So coming to the limitations of the first generation dentin bonding agent, these are quite obvious. First was there was high polymerization shrinkage. Second, there was high coefficient of thermal expansion. Third, very low bond strength of around 2 to 3 megapascals, and there was loss in the bond strength over time. So these first generation agents were not clinically successful. The next were the second generation bonding agents. They were introduced in 1970s in an attempt to bond chemically to either the inorganic or the organic components of the dentin. Okay, the phosphate ester bonding agents of NPG-GMA, bis-GMA, phenyl phosphoric acid were introduced. The bonding mechanism of this generation mainly depended upon the smear layer for the bonding. The smear layer was not removed. It was based on the polar interaction between the negatively charged phosphate group in the resin and the positively charged calcium of the smear layer. So it was based on the surface wetting phenomenon. The example of this generation were clear fill bond system F and the Scotch bond. We talk about the limitations of the second generation, the primary bonding, it was to the smear layer, which prevented the intimate resin dentin contact, which is a prerequisite for the chemical reaction. So no chemical bonding was occurring. The bond strength, though higher than the first generation, but was still very low, that is 5 to 6 megapascals. Next were the third generation bonding agents. Okay, two approaches were employed in this. First was to modify the smear layer to improve its property or remove the smear layer without disturbing the smear plugs. Three component system was introduced in this. First was the conditioner, second primer, and third adhesive. The conditioner, it removed or modified the smear layer. It also does the decalcification of the intertubular dentin to a depth of few microns. Okay, basically it is conditioning the dentin. Example, 2% nitric acid, 2.5% malic acid, phosphoric acid was used. Primer, the primer molecule's function was that it contained two functional groups, hydrophilic and hydrophobic. Hydrophilic, affinity for the dentinal surface, and hydrophobic, bonded with the resin. For example, HEMA and 4-meta. Third was the adhesive. The adhesive, it infiltrates into the demineralized or the primed dentin. Okay, it will copolymerize with the primer to form an intermingled layer of collagen and resin, which was called as the hybrid layer or the resin reinforced zone. Though this layer was introduced here, but the concept and the researches that was done after the third generation bonding agents. Example of the adhesive was bis-GMA, TEC-DMA. So a three-step technique was followed in the third generation bonding agents for the dentin. First was dentin conditioning. Remember, the enamel is separately etched, but the aggressive etching of the dentin was avoided because it could cause pulpitis. Second, priming, applying the primer. Third, applying the adhesive or the bonding agent. The advantage of third generation was a high bond strength was achieved of 17 to 24 megapascals because we are altering the smear layer, which is increasing the penetrability. These show reliable and consistent results. The disadvantages were it was technique sensitive because we were doing the enamel etching, dentin conditioning separately. And also it was time consuming because multiple steps were involved. Over drying and over wetting of the dentin was also occurring, which was causing sensitivity. Then the brand like OptiBond and Scotch Bond, they were the third generation bonding agents. So from the third generation, we move towards the fourth generation bonding agent with the new concept of total etch technique. Okay, what was this technique? The previous generations, they relied on the separate etching regimens for the enamel and the dentine. In this technique, same conditioning agent was applied to both the enamel and the dentine, which resulted in major reduction in the clinical complexity. So in the fourth generation bonding agents, three steps were followed. First was the step 1, etching. Total etching was done, removal of the smear layer and etching of both the enamel and dentine with the same agent. Phosphoric acid, citric acid or oxalic acid can be used. Second, rinsing the surface. Third, no drying. So wet bonding concept was introduced here. Okay, step 2 was applying the primer. Primer can be anti-GMA, then HEMA, 4-meta, followed by the step 3, which was applying the adhesive. That can be BIS GMA or TEC DMA. Okay, example of the 4th generation bonding agents are Allbond 2 or Panavia 21. With the fourth generation bonding agent, the concept of hybrid layer was proposed by Nobu Nakabayashi in 1982. You know, this was the mechanism of dentine bonding. Okay, what is this hybrid layer? When the primer and the adhesive, they are applied to the conditioned dentine, it penetrates the intertubular dentine and it forms a resin dentine interdiffusion zone or the hybrid layer. Next were the fifth generation bonding agents. These are the simplified version of the fourth generation bonding agents. How? They have reduced the number of clinical steps. Okay, it is a two-step total etch technique. What they have done, they have combined the primer and adhesive in one bottle. So now there are two steps, etchant and the bond. Okay, examples of this generation were 3M single bond, one-step Bisco, prime and bond. Now, in the evolution of the dentin bonding agents, we are moving towards the sixth generation bonding agent. We started with the no etch technique in the first and the second. Then in the third, we conditioned the dentine, etch the enamel, moved to the total etch technique in the fourth, in the fifth generation. Now we are moving towards the self etch technique, that is the sixth generation. What is the self-etching? These are the self-etching primers. That means we have combined the conditioner and the primer in one bottle, followed by the adhesive resin. Okay, what does this combination do actually? It dissolves the smear layer. There is no etching or rinsing of required. Then there is no opening of the dentinal tubules, which reduces the post-operative sensitivity. But this has reduced the bond strength as compared to the fourth and the fifth generation, though it has simplified the technique. Next is the seventh generation bonding agent. It is the all-in-one adhesive. It has further simplified the sixth generation. In the sixth, there were two steps, but in this, they have combined the conditioner, primer, and the adhesive all in one bottle. Okay, so there is no etching, no rinsing required. It is a one-step procedure and it is a light cured formulation. Okay, but though again it has simplified the technique, it has reduced the number of clinical steps, but it has also lowered down the bond strength. Now let us just quickly summarize all the generations of the dentine bonding agent so that there is no confusion. Let us start with the first and second generation, which came up in 1950s to 70s. In this, the dentine etching was contraindicated. Okay, it was not advocated. Adhesion was to the smear layer and it had a weak bond strength. They were not much successful clinically. Coming to the third generation, which was introduced in 1980s, etching of the enamel and the conditioning of the dentine was done separately. Okay, the smear layer was modified. Priming of the dentine was done. okay, followed by the adhesive. It had a better bond strength as compared to the first and second. Coming to the fourth generation bonding agent, which came up in early 1990s, in this the total etch concept was introduced, total etching of the enamel and dentin. Both the enamel and dentin were etched with the same etchant and there was removal of the smear layer. Hybrid layer concept was introduced. Wet bonding concept was introduced. That means bonding to the moist surface, but there were multiple clinical steps involved. Coming to the fifth generation, mid 1990s, it was the simplified version of the fourth generation in which the primer and the adhesive were combined in one bottle. So it made into two steps. It had a higher bond strength and the clinical steps were reduced. Coming to the sixth generation, which came up in late 1990s, the self-etching primers were introduced. That means the primer and the etchant were incorporated in one bottle. Okay, this reduced the post-operative sensitivity, but it had lower bond strength as compared to the fourth and fifth generation. Coming to the seventh generation, which was introduced in 2000s, all in one bond concept, one step. Okay, one step bonding. The etchant, primer and the adhesive all were in one bottle. The bond strength was lower as compared to the fourth and fifth generation, though it was a simplified and also reduced the clinical steps. So that's all for this topic. I'm sure now you have no confusions, no doubts. Still, if you have questions, you can give in the comment section or you can give your topics in the comment section. Do like and share the video. Wish you success, my dear students, today and always.